My name is Mohamed Ali. I'm the National Treasurer for the Union and Public Health Officer, licensed and passionately practicing public health at heart. The gaps that are there, this summit want to bring out is the aspect of policy part and also the part of implementation. So there is a huge gap whereby policy does its bit and implementation takes another toll to it. There is a gap also in between the coordinating aspect of it from the national levels and county levels. There is also another gap, especially in terms of allocation of funds. So that is another gap whereby we are trying to spearhead through this, because we know finances are always the drivers of this policy. And when there is financial constraint to it, that means from the policy formulation to the policy implementation, the gap will always be there, and it will always have a ripple effect even into the public health functions which are already there within the public health domains. The first one is the coordinating gap. There is one coordination gap, especially between the national levels and the county levels. And another thing is finance allocation or funding of public health functions. The third one is the human resource aspect, the human resource management. We want to bring the narrative of funding. Believe you me, if you do $1 in preventive, we gain a return of $7 in return. That shows that is a prospective area to fund. And that is something that we are also eyeing to it. Another thing is to make sure that if there is a gap in terms of human resource, even in terms of delivery of service, will be minimal. And in case there is high levels of, let's say, attrition, there is high level of greener pastures and those who are retiring, and there is no gap which are filled, then that means we will have another bone of contention later on. And this is the right time to start by when we are coming out of that summit. Having a powerful engagement is not about discussion, it's about implementation. We want to bring change, and this is the right time whereby we want to showcase our skill set, professionalism, in terms of making sure that we have something that will be tangible. One, to bring a discussion whereby funding, human resource, digital, health, all those things are now part and parcel of us. And we want to make sure that during that time we have that in the agenda. When we have health, we have hope. And when we have hope, we have reason to live. Public health officers, specialists, technicians, come one, come all to that summit. Usibaki nyuma na usikose uchekwe.